Hi, this is Dr. Benny Vreeland, and I'm here with Pat Pothier today. We just finished doing a video about PTSD, and we talked about how it affects the military, people coming out of the military, people who have been in the military, and perhaps after a period of even 25 to 30 years are experiencing PTSD. So, Pat, what about civilians? How are civilians being affected, or are they?
They are. That's a great question. PTSD stands for post-traumatic stress disorder, and a lot of people associate that with veterans. And they've heard the statistics about veterans. 22 a day are committing suicide, 8,000 a year cumulative. What they're not hearing about are the 11,000 a year that are attempting it and not succeeding. But those are the statistics that they're hearing a lot about, and they know how it affects them. Depression, anxiety attacks, fear of loud noises, fear of bright lights, very important around the 4th of July. Fear of crowds around the holidays.
That's huge, 4th of July.
Oh, it's humongous. But that's how they associate it with the military population. However, this carries over. The definition of PTSD is either witnessing or being a part of a traumatic event that caused physical harm. Think about some of the things that might happen in everyday life. You have bullying, social media bullying, rape, gang rape, incest, all accidents, being a part of a traumatic accident where somebody maybe died or killed or seriously hurt. So it is affecting the population across the country. The difference is, and this is fascinating as well, the statistic is that they also are committing 22 suicides a day. However, it's not being reported as much because the population is so much larger than the military population. So the percentage is higher for the military, but it's still, if you compare the civilian population to the military population, 44 a day are committing suicide because of PTSD.
That is simply astonishing. And we hear about teenagers that have been bullied.
Yes.
But we don't, and that's PTSD.
Right.
But we don't hear about is the quote average American citizen who is a mature person who perhaps commits suicide or has an accident and associate that with PTSD.
Right. So
because it could be other things.
It could be. So with the military, the population there, they're seeing the suicide rate at 25 to 30 years after the event.
Right.
When we're talking about the civilian population, we're seeing that being happening at a much, much younger age. You said teenage years.
Right.
You can open the paper just about any day during the week, once a week, and you're seeing a teenager that's committing suicide because of bullying that happened at school, over a period of years. So it's happening at a much younger age, and unfortunately it's happening to a much larger population, so you're not really hearing that statistic of 22 a day.
So tell us how we can help.
Well, we have a number of different ways that we can help, and I certainly think we're going to talk about that in our next segment. But there are some ways that we can help that are beyond medication, giving them antidepressants, that is beyond counseling that's going to take a period of years. There are some alternatives that we can discuss that are certainly very promising.
Let's do that.